So today we're going to be taking a look at sepsis, and to describe it in a way that kind of simplifies it, we're going to be looking at three main categories. And the first one is going to be represented by this beaker, and this beaker is showing all of the blood volume that we have in our body. So all the volume that's in the vasculature is represented in this beaker here. The next main section we're going to be looking at is our heart. And as we go through, we'll kind of explain what mechanisms come into play as we progress through sepsis and what our heart does to try and compensate for those factors. So as blood passes through the heart, it kind of gets shunted to two main categories. We have our non-vital organs, such as our skin and tissue, and then we have our vital organs, such as our kidneys, liver, and brain. So without proper functioning of these, the body loses the ability to properly regulate itself. So blood flow is critically important to get to these areas. Now, whether blood flows to non-vital or vital organs, it all does kind of shunt back through the same venous system. So it's all going to kind of be represented through this one vessel coming off of both non-vital and vital organs. Now here you see a white blood cell, and we have these coursing all the way through our vascular system. And as it's going along, we're going to see this bacteria here, and as bacteria enters the vascular system, a couple things are going to happen. The first is that the white blood cell is going to release some chemical mediators, and these chemical mediators do a couple things, and there's a couple of them at play, but to simplify, we'll just keep it down to just kind of one. So as the white blood cell picks up on the infection and these chemical mediators are released, we're going to see increased white count to the area because our body is picking up on that there is an infection, so we're going to get increased white counts. We're also going to see vasodilation of the vasculature. Now, in a localized infection, this is important because let's say you have an infection in your hand and it's in the tissue. This vasodilation allows for more red blood cells, platelets to arrive for clotting, and white blood cells to arrive for fighting off infection. But when we have a systemic problem, we get this vasodilation all throughout the body, which is a problem. The next problem is the increased permeability. Now, white blood cells can't just pass out of the vascular system into the tissue to fight off bacteria. So some of these chemical mediators that they release cause vasodilation of the cell wall, and you can see it here on the right side, and so it allows these white blood cells to pass through the cell wall and into the tissue to fight infection. Again, this is really important in a localized infection, but when you have this on a systemic base, you're seeing this all throughout the body. So this is going to cause capillary leak, and so you may see some edema and some fluid loss, and again we're losing even more of our volume throughout the body, as well as with this vasodilation. So we kind of have two things at play here: the dilation, which is dropping blood pressures, as well as fluid volume loss and this leaking. So as this leaking happens, our body's going to use up all of its platelets and clotting factors to try and plug these holes. The problem is that our body sometimes doesn't regulate very well, and it will use up every resource it has to try and do this, but this is continuing to happen, and this infection will outlast our platelet count. And so what happens is we end up seeing patients with labs where they have a decreased platelet count and increased INR and APTT. And again, this is due to the fact that our body is using them all up. At this point, we're also going to be seeing kind of elevated temperatures. Might be just orally, nothing too crazy at this point, but it will increase as time goes on. Now, as red blood cells continue on their way throughout the vascular system, there's another problem that we run into with this increased dilation. There's more fluid for the oxygen to pass through to get to the tissue. So some of it kind of gets lost. So there's actually a decreased oxygen supply to the cells throughout the body. So for a while, this is okay because our cells can switch to anaerobic metabolism. Now, cells need ATP to function to get their energy, and if they don't have enough oxygen to create that the Krebs cycle, they can switch to anaerobic metabolism to kind of sustain their functions for a while. The problem is that byproduct is lactic acid, and lactic acid gets leached back into the vascular system. And what happens is when we test our patients' blood volumes at this, or labs at this point, we'll see that increased lactic levels. So when we see these other symptoms and we look at our sepsis sheet, that's the reason we're testing the lactic levels. We're seeing how well is the tissue, how well are the organs being oxygenated throughout the body. And if they have really high lactic levels, we can tell that this tissue is really struggling to maintain its function. Now, as this lactic level increases, we need to get rid of it. So one thing that patients will do as they become more acidotic is they're going to increase their respirations. And this increase in respirations is going to be an attempt to blow off excess CO2. So what can we do at this point? So the first thing we want to do before we start any antibiotics is get blood cultures. This is so we can move from broad spectrum antibiotics to a more specific antibiotic to be most effective against whatever organism is in place. Next, we'll start our antibiotics. In addition, sometimes they may bring on vasopressors at this point, and the thought behind this is to kind of decrease that dilation of the vasculature and increase that blood pressure. So to try and compensate for this, the heart is also going to try and kick up its output. So we're going to see patients with an increased heart rate with it, which is again another sign of sepsis. So we have these increased respirations, increased heart rate, elevated temperature, along with our labs. These are all key signs that sepsis are taking place. The next problem we run into is with this dilation of all of the vasculature, our body loses the ability to regulate where blood should go. So typically in like hypovolemic shock, our body would clamp down on the vascular system kind of going to the non-vital organs, and this would shunt all of the blood to our vital organs. Well, due to this dilation, it can't do that. So we get equal blood flow to the non-vital and vital organs. So when we touch our patients and they feel hot to the touch or they have an elevated skin temperature, it's because of this dilation and increased blood flow to the skin. That's why they feel warm. Now again, to this decreased volume throughout the body, we're going to see effects in our vital organs. And here's where we see some of our other key symptoms with sepsis. So in our kidneys, due to decreased blood volume, we're going to see decreased urine output due to this kind of the lower blood pressures and the leaking. Our body's going to try and retain everything that it has to try and kind of boost those back up. Next, we're going to be focusing on the liver. Now, the liver can be a little complicated on what's happening specifically in sepsis, but primarily as the body moves to MODS and we see liver failure, we lose the ability to break down and process the bilirubin. And that's where, if we look at our sepsis sheet, we're going to see increased bilirubin. In addition, with cognitive function, we're going to see cognitive changes. They're going to become more confused, agitated. We're going to see changes from baseline, and again, this is due to changes in cerebral blood flow. So another thing we can do is if we looked at the oxygenation of the arterioles, we can see that typically they're around 95%. So if we were to get a blood draw from there, we could say, okay, 95%, that's kind of a normal baseline for us. And if we were to take a blood draw from the venous system, we'd see that that's more around 70% on a normal case. So for our septic patients, if we're going through these treatments and we test this venous oxygenation, it can kind of lead us to go down two different pathways for treatment. So if we get their hemoglobin and it's less than 10, we know that we need to transfuse the patient. But if we look at their hemoglobin and it's greater than 10, we know we need to increase the cardiac output.